What's going on, everyone? Happy Monday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, July 15th, 2024. If you're new to my channel, maybe you clicked on this video because you just came back from vacation and you tested positive for COVID right now. There's a lot of that happening right now. Don't feel like you're the only one having that happen to. We're in a major summer wave, and COVID cases continue to rise across the United States. In just a little bit, we're going to take a look at new data that shows how much cases are rising around the country. And yes, a lot of people, they're testing positive, but they think, oh, well, wait a second here. I thought COVID was over. How can this be? Surprise, COVID's not over. You just don't hear about it much on the news. You do hear drips and drabs here and there, but you don't hear about COVID, and you don't hear much about the other viruses as well. We talk about them as well as needed, and today we will be talking about some of those other viruses. So if you're new to my channel, subscribe down below. Give this a thumbs up. The more people that hit that like button, the more YouTube's going to push this video throughout the algorithm. Let's try for going big today. Let's try for over 200 like button hits for today. Of course, share these videos with anyone you know. Leave a comment down below and hit that notification bell. Alrighty. Starting off with New Zealand today. New Zealand reports another 2,640 new cases. 30 more deaths have been added there. This is down on cases. They previously had 2,772 new cases. 169 cases in the hospital, and none were in the ICU at this time. Now moving on to what's going on in Colorado with H5N1. Unfortunately, there was a surprise Sunday announcement that they had 2 more human cases of H5N1 bird flu. Kind of concerning given that it was a Sunday. They don't usually report, or a lot of health departments don't usually report on Sundays, but this does stem back to what's going on at a commercial egg layer operation where, a chicken farm. So the chickens were already infected. It was a possibility that the workers get infected as well, and this has happened. We'll have to see if the outbreak grows. We'll have to see if the outbreak then spreads to the family members. So as of now, there are 5 poultry workers since Friday that have been infected. All right, moving on now overseas, and check this out. This is coming from a UK news source. Woman's dream Canary Island cruise ruined after 200 forced to stay in cabins with illness. Illness aboard cruise ships has been a problem long before COVID even started. I mean, prior to COVID, you get a large number of people together, confined to one cruise ship, and guess what happens? There's a chance that you could have people come down and get sick, and guess what? There's a chance that people come down with illness now as well, even more so now with the COVID virus. But in this case, it's a norovirus type illness. 200 people were forced to stay in their cabins. People were throwing up. People were having diarrhea. All that horrible, awful stuff. We won't go into any more details, but yes, passengers are not happy about this. Want to read the full story? I did just tweet this out. And if you happen to be going on a cruise, see these little rapid tests in the picture here? This is an advertisement, but it's a good reminder. Pack some rapid tests with you, or better yet, don't plan on to go on any of these large cruises. Norovirus-like illnesses and COVID-like illnesses are a big issue on these ships. All right, B&O's weekly update on what's going on here in the United States. New cases, 120,934. That's a pretty big increase. The average is 95,250. That average could go over 100,000 pretty soon. And we know the actual number is probably much higher just based on wastewater data alone. The average, it went up by 13,780. In the hospital, 2,920. That is up by 369. In the ICU, 288. That's up by 58. New deaths, 540. That number is now starting to rise. The average is 470. That is up by 32. If I had to guess, my guess would be we will probably stay above 500 deaths each week for quite some time now. I hope maybe it'll come lower next week, but, with the way things have been rising, deaths are the last lagging factor. It was only a matter of time until they started to rise. So we'll have to watch what happens with that. Moving on, many parts of the U.S. have seen substantial increases in COVID-19 activity over the past few weeks, though the amount varies by region overall. COVID levels this summer are higher compared to last year. Now, I want to say one thing. Yes, they are saying it's higher, but one of the reasons why we are higher at this point, the wave did come earlier. We'll know in a few weeks as this wave continues on. Actually, no, let me correct myself. We probably won't know until post-wave if this wave ends up actually being higher in terms of cases compared to last summer, or hospitalizations for that matter as well. We'll know when the wave is over with if it ended up being a bigger wave than last summer. But right now, I want to stress again, this wave started earlier. That's why we are so much higher right now because, well, we're further along into the wave. How long the wave's going to last, that remains to be seen because of the ever-changing variant picture. The most notable increases this week were reported in Florida. 108% increase in cases. Wow, that's bad, and that's also totally ridiculous. That is unacceptable. Come on, Florida. Stop being such a super spreading state in the summertime. Totally ridiculous. Ohio, up by 76%. Michigan, up by 32%. New Jersey, up by 32%. New York, up by 22%. California, up by 21%. Some may be affected by 4th of July backlogs. Yes, that could also be a reason why cases and deaths are much higher this week, which is why I do hold out a tiny bit of hope that maybe deaths will come in lower next week. We'll see. Only 34% of hospitals in the U.S. submitted COVID data this week, which is similar to last week, but down by 91% in May. This means actual case numbers and hospitalizations are higher than reported. The number of deaths reported this week, 540, is the highest since early May. It's also the 226th week in a row with more than 400 new COVID deaths in the U.S., or nearly 1.2 million deaths during the same period. So far this year, more than 3.8 million COVID cases have been reported in the U.S., causing 304,772 hospitalizations and 32,588 deaths. I hope we do not see one thing that did happen last summer, and that was post-September we saw deaths go over 1,000 deaths a week, and BNO kept track of how many weeks in a row that was. Hopefully we can stay below 1,000 with this wave, but only time will tell. We'll have to see what happens. Alrighty, moving on. With the summer COVID surge raging on, have you noticed an increase in coughing as of lately? That was a poll question we asked last night. It got 417 votes so far, 8 hours left. 79.6% of people said yes, 20.4% of people said no, and a lot of people said yes down here. Some said their co-workers. Some people did say no as well, and wow, this is not good. Someone put, I'm in an ER right now, and it's rampant in the hallways, waiting room, the rooms next to me. Yikes, that's not good. Please stay safe if you have to go to the ER right now. Alright, up in Canada, there is an outbreak at the Grey Gables long-term care facility in Owen Sound. A COVID outbreak has broken out at the Pine Ridge home at Grey Gables in Owen Sound. They are requiring all visitors to wear masks and eye protection. When's the last time you heard them mention eye protection? You have not heard that mentioned in a long time. I mean, very rare. Mask, yes, but not eye protection. Do you want to find something on my website? Maybe it's a past outbreak. Maybe it's something, I don't know, that has happened recently. Or maybe it is someone that has tested positive for COVID. Or anything. Well, you can just go right onto the page of my website, datareport.info, and you can even type things up in the news bar as well. Like, for example, George Lopez. We know he had COVID. Look at this. Watch what happens when we type in his name. Well, look at that. His case does come back up. And he had COVID back on December 11th of 2022 is when I shared that story. And you can see he was 61 years old at the time. And you can do that. Type in a name. Now, not all COVID cases are in here, but the ones that I have added. And I think at this point we're probably approaching 200 or coming close to over 200 at this point. And that number is only going to continue to grow. And I will slowly add past cases. Someday it may go over 1,000, sadly. All right, moving on. Taking a look at what's going on with the national allergy map. No orange anywhere. Lots of yellow today. 49% of the country is in the low to medium status. The most yellow is in the western portion of the United States. Taking a look at today's air qualities, not much that can be said. It's pretty bad across much of the country. So if you have to go outside, please be careful, especially in the east along the I-95 corridor, where air qualities are really bad today. Taking a look at heat-related illnesses, and we do need to refresh this. So drum roll, please. I'm expecting this map to look worse. And the West Coast is really bad at this time. And the Northeast is starting to pick up the pace, as is Virginia, North Carolina, all of Delaware, Southeast, actually not terrible, and the Great Lakes and Midwest is not terrible at this time. You want to learn more about climate and weather, you can do so over at my other page, Climate Data Report on X, and we do have a YouTube channel as well, Climate Data Report. Haven't posted there in quite some time. Taking a look at Philadelphia yesterday. Philadelphia on Sunday had 778 EMS incidents, and taking a look at what's going on in the rest of southeast Pennsylvania, well, a couple counties. Montgomery County, we do note there are a few calls going on right now. And I can tell you, I have seen quite a few ambulances today when I was out and about earlier. Chester County, Pennsylvania. Wow, lots of calls right now. Sick person 1, sick person 2, sick person 3. Respiratory difficulties also shown up multiple times as well. So, yes, it's a sign of the times. Heat-related illnesses and a summer surge of COVID. All right, drum roll, please. The new update of Walgreens is in, and it's kind of a mixed bag of things. We do note this week there is a big increase in testing done at Walgreens, which is why the positivity rate has dropped. Current week's positivity rate is 39.2%. Prior week was 39.6%. Difference of down 0.4%. Testing, 6,767 tests. Most I have reported from Walgreens in a long time. 5,109 last week. So there's a couple reasons why it's dropping. One, that's a big increase in testing. Two, some signs that the West Coast may be starting to peak relatively soon. How about today we start on the West Coast, taking a look at what's going on up in Washington. Testing did go up, but positivity rate did drop as well. I think it's a combination of both. We've been noting that Washington is starting to improve. 41.5% positivity rate this week. The prior week was 47.6%. Difference of down 6.1%. Then when we come down to California, we see that the positivity rate, it continues to rise. 42.8% this week, 39.6% last week. Difference of up 3.2%, 353 tests versus 235. New Mexico, 29.7% this week, 50% last week. Testing did increase to 37 versus 26. Kansas this week, 41.2% positivity rate. The prior week was 20%. That's a difference of up 21.2%. Total tests, 51 versus 25. Ohio this week saw a big increase in everything. 46.1% positivity rate versus 30.9% last week. That is up by 15.2%. Total tests, 115 versus 94. And we did read a news story yesterday that said Ohio cases are going up significantly as well. Virginia this week reports 40.8% positivity rate versus 30.8% last week. That is up by 9.9%. Total tests, 184 versus 120. Florida this week reports that they had a 43% positivity rate. That is down slightly, 45.1% last week. So, yes, it is down by 2.1%. Total testing is up 1,065 versus 904. With the wave starting earlier this year, you have to wonder, maybe Florida is going to peak relatively soon. Taking a look at what's going on in Mississippi. 20% positivity rate this week, 15% last week. That is up by 5%. Total tests, 25 versus 20. And what do we say? Let's do one more state. Let's do Wisconsin. Wisconsin this week, 41% positivity rate versus 41.1% versus 37.3. That's up by 3.9%. Total test, 158 versus 102. Canada at this time. your COVID levels are currently in the moderate, and flu A is also coming up moderate. Flu B is low, and RSV is low at this time. Let's take a look at a couple wastewater sites. There's probably going to do two here. Memphis, Tennessee, and we're only looking at COVID. It was rising. As of lately, it is starting to drop once again, and everything else seems to be fine at this time. Some slight hepatitis A detections. Let's go up to the north. How about we go up into Vermont? What is going on in Montpelier? You know, the capital of Vermont. Take a look there. You can see one of these wonky movements. So, yeah, we're not going to go by that. Maybe Burlington is not showing a wonky movement. And it was a wonky downward movement after going upward. Okay, Burlington, yeah, slightly wonky as well, but it is going upward at this time. 30,000 population at Essex Junction, Vermont, which is not far from Burlington at all. Drum roll, please, as we refresh the New Jersey COVID dashboard, if it does come up. Let's see what New Jersey reported for today. What magic number are they going to pull out of a hat? It does seem like they do just pull numbers out of a hat these days. Okay, today's 268 hospitalizations. 70 out of 70 hospitals reported. 11 people on a ventilator and in the ICU at this time. 30 people in the ICU. Discharges. Let's see what's going on with them. 44 discharges reported at this time. New York State today reports 1,560 people tested positive. That is slightly less than last Monday, but some of last week's data could be, I'm just guessing here, could be backlogged because of the holiday week before. And when we take a look at what's going on in the hospital situation, 968 people hospitalized, 73 people in the ICU. They did end the week last week with a decrease. Hey, any decreases in anything, backlog or not, is a good thing. We'll have to see if that continues, although I do suspect they will probably go over 1,000 hospitalizations again tomorrow like they did on Tuesday of last week when they reported on the 9th. That was 1,003 people in the hospital. I think they'll probably beat that number tomorrow, but we'll have to wait and see. Alrighty, folks, that does it for the Monday edition of the Pandemic Update. We'll have another Pandemic Update again tomorrow. If you enjoyed this update, give it a thumbs up. Want to see more data like this? Subscribe to my channel down below. Share this video with anyone you know. And remember to hit that notification bell. And remember to leave a comment down below. Did you test positive? Are you hearing more coughing? Maybe there's something that you saw on here that you want to comment about. Leave that comment down below. I will see you all again next time. Until I see you again, stay safe, everyone, and have a fantastic Monday evening. Thanks for watching.